Here with Dr. Shari Lewis Foster, who has been so gracious to join me. We've been talking about this for over a year now, and here we are. I'll introduce Dr. Shari. She's a board-certified nephrologist and a partner at the Nephrology Center in Maryland, and happy to have her here. All right, welcome.
Thank you for having me, Micah. This is impressive.
Certainly, and happy to have you here. What's going on in nephrology? What's new?
Nephrology is an amazing space, and in fact, this is a great time to be a nephrologist because there's been an explosion in research now, particularly with diabetic kidney disease, and I think probably you and a lot of our listeners know diabetes is one of the major causes of chronic kidney disease, and right now there's an explosion of research in that space, and it's a really exciting time.
Great. Can you explain what the primary function of the kidneys are?
Oh, certainly. A lot of people know one of the primary ones, which is to make urine, which is the manifestation of which the kidneys excrete waste. So the kidney is very involved in getting rid of waste from the body. But the kidney also has a lot of dabble in other forms of health, particularly even in maintaining blood count, which is something you don't think about often. The kidney is the organ that sends the signal to your bone marrow to say, make blood. The kidney is also involved in management of vitamin D, which is one of those vitamins we need for bone health and for our immune system. The kidney is also very involved in the management and excretion of not just waste products, but also for excess fluid. You drink a lot of water, the kidney gets rid of all that excess and keeps you breathing well and keeps you healthy. So the kidney has a lot of functions, not just excretion of waste, but also in a lot of other organ management.
The natural habits, lifestyle habits such as diet and hydration, do you recommend for maintaining optimal kidney health?
Yeah, the major one you just said, hydration. Key is hydration. Water intake particularly, not just all fluids. There's a difference between drinking water and drinking coffee. Hydration really comes from water. The kidney is, as I said, very much responsible in excreting waste, and for the kidneys to do that, it has to be coupled with water. So drinking lots of fluids is very important for kidney health. And not just drinking fluids, also just a healthy lifestyle. The kidney sees whatever you're doing, whatever you put in your mouth, a lot of it is excreted by the kidneys. So you want to make sure good things in to protect the organs and what's going out. Eating healthy foods, diet that's rich in fruits and vegetables, that's very important. Reducing alcohol as a healthy thing. Alcohol is one of those things that tells the kidney, hey, put out the extra water that you are drinking. So in order to stay hydrated, you really want to reduce alcohol intake to a very minimal, and if possible, eliminate alcohol generally from your lifestyle. Salt. Restricting salt intake is also another lifestyle intervention that can help with the kidneys. And then exercise. I can't implore how important exercise is to lifestyle. Exercise helps building healthy muscle, and with healthy muscle, you have healthy proteins. Healthy proteins lead to a stronger immune system, and that protects the body on a whole.
Circulation, muscle strength, better circulation, and things like that.
I think smoking, another big one. Smoking is probably one of the worst things you can do in terms of maintaining good circulation. So the kidneys need blood supply. And if you're smoking, you reduce your ability to deliver blood to your organs. So reduction of smoking. So there are a lot of lifestyle things you can do, starting with water, exercise, healthy foods, and reducing things like smoking and alcohol.
Yeah, great advice. What would you say some of the things that you're primarily seeing in your patients these days?
Yeah, great question. I have both an inpatient and outpatient practice. I take care of both chronic kidney disease patients, meaning patients that are not yet on dialysis, and we have even mild kidney disease, to patients with end-stage kidney disease that are already on dialysis. So I see a full gamut of patients. And in my chronic kidney disease, I would tell you the majority, as I mentioned before, of my patients I see have diabetes. So I can already tell diabetes is one of those huge factors that can affect the kidneys. I would say about 80%, roughly, if I'm thinking my patients with chronic kidney disease also have coexisting diabetes. And usually diabetes is the cause of the chronic kidney disease. So I see a lot of that in my practice.
That would definitely be attributed to lifestyles.
Yeah, there is a genetic factor as well, but there's also a big environmental factor in that obesity and the type of foods you eat, insulin resistance, which is happening as we eat poor foods and we gain excess weight. Definitely lifestyle, again, is coming into play because healthy lifestyle reduces the risk of getting full onset diabetes And we know diabetes is a risk for kidney disease. So again, yep, huge diet and lifestyle. So I would even tell you my practice has become very heavily focused on preventative care.
Wow. That was
Heavily
actually my next
focused.
question.
Yeah, heavily focused because
Yeah.
that's what I'm seeing.
Yeah.
I'm seeing the patients who are coming in with early diabetic changes and
Yeah.
obesity, and then 10 years later, because of poor control of diabetes and poor lifestyle, now ending up on dialysis. So the question I have always asked myself, is there anything we can do ahead of time to prevent this progression of kidney disease? And that's where lifestyle comes in.
Wonderful. Yeah, that was actually my next question.
Yeah.
Like, how are you treating these patients? What's your recommendation based on the fact that even though some of it might be genetic, I think majority of it is attributed to the environmental factor.
Yeah, absolutely.
Are you actually saying that your practice has moved towards helping those patients in terms of looking at their lifestyles?
Because there are the pharmaceuticals out there, and don't get me wrong, pharmaceuticals can become a very important part of treating that.
For sure.
But at the core, we should start with lifestyle. Because you can I tell my patients this all the time, I can throw 20 million medications at you, but if you don't change how you're eating and you don't change your exercise habits, medicines are probably not going to work as well. Sometimes it's complementary, yes, but at the core, you have to change and look at what you're eating, how active am I, because those things are probably more important than the pharmaceuticals that are out there.
I would agree with that wholeheartedly. And Hippocrates, it says let your food be your medicine.
That the food is,
And
you are what you eat.
So as doctors has taken that Hippocratic oath is to really understand what that really is. And while I think I agree to the fact that medication and pharmaceuticals can actually be assisting and helping, but it shouldn't be the first resort. It should be something that's complementary, more secondarily than the first, or even tertiary, than the medication being the first resort to treatment. How do you balance and delivering news about kidney health, hope and plan for action in your patients?
I hope to get it right, but I probably don't get it right all the time because I would tell you, especially for first patients coming to my office, they're always scared. I think once you hear the news of kidney disease, patients automatically, or I should say people automatically think the worst. So I off the bat have to deal with a lot of nerves when a patient walks into my office, especially for the first time. I think everyone has this notion kidney disease means you're ending up on dialysis, and that's not true. In fact, a lot of patients with the proper preventative care can have a chronic disease that's well controlled and not necessarily progress to dialysis. I think a lot of the times when patients come in, I have to reassure them that yes, you're here because you have kidney disease, but this does not, one, define you, and two, I'm glad you're here because maybe there are things we can do that can prevent things from progressing. So that's usually my first approach. But despite that, yes, I have patients who do walk in with very advanced disease, and we do have to talk very heavily about possibly transitioning to dialysis, which is a very tough thing to deal with psychologically. A lot of the time is being honest. I have to be honest as a provider and provide support. A lot of the times I'm also co-managing with patients who may need behavioral health therapy in order to deal with a very difficult transition. Another thing that I often always ask my patients to do is bring someone in with you. Bring someone who you care about, love, a close friend, a family member, because sometimes having two pairs of ears there may be more helpful than just one, and just to offer that help, that hand of support, because it is a tough thing to deal with, especially transitioning to something like dialysis, which does consume time and sometimes has its own risks and side effects. So it's a very tough time. So usually offering to have family members there at that appointment sometimes offers a lot of support. And also, as I said, we work with behavioral therapists too, who may help with that transition.
To help with the mental aspect.
It's huge. There's even data that with patients that are on dialysis, 70% have some form of depression. That's how much mentally this disease can wear on patients. So having a multidisciplinary approach, I think, is really important.
That's great. Can you share a memorable story about a patient that has a lasting impact on you in terms of your practice?
Wow. I feel like there are so many. I have one patient that I'm dealing with right now. She's a very young patient in her 30s.
Oh, wow.
And whenever I have a patient that's younger than myself, I feel because kidney disease sometimes brings a lot of burden. And this is a patient who is young and had to deal with that mental struggle of needing to start dialysis for very advanced diabetic kidney disease. She has kids. She's a single mom and having to deal with adding dialysis on top of that. So I think I became very close because a mom myself and just thinking of adding so much health burden onto someone who's already dealing with so much. But she has triumphed in that now she started dialysis, saw this as an opportunity to help others. So she has actually been very vocal about chronic kidney disease. She has a platform where in the lobby sometimes she meets with patients and offers support. And now she's started her own healthcare support group that she's reached out to others and she's helping them. So it's, for me, it's the strength because I think I was more worried, but she really used this as a stepping stone, not just for herself, but to help others. Just being so inspirational that she's working, a mom on dialysis, but yet finding time to help others. That's amazing. She's amazing. So she's inspired me that no matter how tough things are, you can always find something positive and always to think about others. That's, So
and that
she
is a memorable story.
Yeah, and she's still doing it, by the way.
Wonderful. That is great. How do you see the future of healthcare evolving, particularly with technology and staffing towards the patient within that particular field in nephrology?
We all know AI is here. It's not coming anymore. It's here. And already I'm seeing ways that AI is offering both good and bad, I probably could say. Benefits or easy access to a lot of information. Healthcare, there's so much information there, research and data and studies. And sometimes you want to look up one topic and there's 2,000 papers. And it's hard to read 2,000 papers. Sometimes having the ability to use AI to summarize a huge amount of data, tell me what I need to focus on, has been great. It definitely benefit. But I think on the downside too is that there's probably going to be too over-reliance on AI. And maybe we still have to use our brains and analyze for ourselves. And that may be something where we have to figure out that balance between using AI and still using common sense and doing our own research.
When it comes to AI technology is understanding that, as you say, it summarizes the information, but that I've seen actually one quote-unquote expert that says, who actually advocate 90% AI but 10% human, just to make sure that we still actually have that decision-making actually left out. As AI is, as you said, just gathering of information, but it's not to the point where that it can actually have that life experience, actually make those decisions based on the information, but it would actually accumulate the information for you. So that's great. But I think the benefits that it does give, but as you say, there's always a segment within our population that actually would use it for malfeasance and in a negative manner. Yeah, I think it's great. What advice would you give to someone considering a career in healthcare and aspiring to specialize in your field?
Nephrology specifically, it's a great field. In fact, we need more nephrologists. I think if you look at the data now, there are more nephrologists probably retiring over the next 10 years that are incoming. So nephrology is a fantastic field. However, I think there are some drawbacks in nephrology that probably young doctors are not seeing nephrology as being as very attractive as maybe some other subfields, particularly because of lifestyle. There's a lot of call involved in nephrology. Our patients are in different places, dialysis centers, hospitals. So we very often go to where our patients are. And that may not be seen as something that's very attractive. But what I would tell you is that nephrology is very rewarding. It's one of the fields where you really get to know your patients. You develop a relationship with your patient like no other because we see our patients so often. For example, patients that are on dialysis, we see them sometimes 4, 5, sometimes even 6 times per month. That's more than probably even a primary care doctor sees a patient. So we become primary care doctors technically, and we're also family because very often we spend more time in that area. Patients on dialysis 4 hours, 3 days a week. That's a lot of time spent in that setting. So we often get to know our patients very well. We get very involved in our patients' lives. So you get to experience healthcare, I feel, from a more personal standpoint. And we really get to deliver holistic care.
That's one of the things I actually like with community nursing as well, is that that more personalized feel as opposed to the institutions. And then as you said with the primary care physician, their time spent with the patient is designated by the insurance company to 15 to 20 minutes in terms of just getting the numbers going. It's great. And having been 3 decades in healthcare, I feel the same way that in terms of the impact and reaching out to the community and working one-on-one with those patients actually makes you feel like you're making a difference.
Exactly.
Like you're really what you really went to school to do, to make that impact. Right. Patients are often so appreciative of the time spent and the care and the knowledge that you actually given to them. I think we're going to try and conclude. I have a lot more questions.
Invite me back.
I think I'll end with one more question. And this is a question from a substack of questions that I have. It says, when you are near the end of your life and looking back over it, what will you be proudest of and what will you regret the most? Dr. Robert Waldinger.
Let me start with saying, up to this point, and I don't think this will change, is that I have no regrets, generally. And I feel like I've had disappointments, but I feel like every disappointment has been a lesson. Yeah. I've not had an experience, good or bad, that I've not said I could learn something from.
Yeah, that's true.
So even with the biggest disappointments, which I have experienced, I can take something and learn something. Either I don't want to ever go through that again. Yeah. In terms of what I would see as greatest accomplishments, I would say family. My husband and my kids. Yeah. Core of everything. Yeah. I feel like it's the reason for everything. Yeah. Working hard, even a patient experience. I think even with my office, majority of what I talk about with my patients now is, let me tell you about my family. I can relate to this. And they know we're humans at the end of the day. Exactly. And I feel like my family defines me right now. And I live for them. I love being with them. Yeah. And I feel like I do work hard, but at the end of the day, a lot of it is for them. Yeah. So that's probably my greatest accomplishment.
Wonderful. And having said that, if anyone stayed to the end and get to know Dr. Shari Lewis Foster, we've been having a discussion about doing something like this for over a year. I'm very fortunate to have Dr. Shari Lewis Foster and her family.
Here we are.
Thank you for your time. Thank you for agreeing to do this, and I hope we can do this again often. Even if not in person, maybe we can do it virtually.
Absolutely.
I'll be reaching out to have you as my guest at a lot more occasions.
And thank you for having me here today and in the podcast room. And thank you for family and for friendship.
Yeah, indeed, certainly. Blessings to have you guys. All right.